Hello there, I'm Dr. Avi Ratnanason, founder and CEO of Energesse, and we're the organization that produced the PME, Pandemic Management Gold Standard tool, which was applied for preparedness and response management at Heathcote Health. And I have Dan Douglas, the CEO, whom we partnered with for this application. I'd like to acknowledge the IHF for recognizing us for this particular Beyond the Call of Duty award. The tool effectively was solving a problem whereby health services in Australia, whether they're hospitals or aged care facilities or even primary care, were identifying at the time of COVID that they had a number of gaps, but they weren't sure what those risk management gaps were relative to preparedness. They also, in where gaps were existing, many didn't know how to exactly implement the solutions or what solution providers there were in the marketplace to help them. So this tool effectively was more robust in identifying the gaps than the existing tools. It helped them identify best practices from around the world that they could apply immediately, and also solutions in the marketplace that they could procure or use to help them solve the gaps. With me is Dan Douglas, and I'll hand over to him on how he applied the tool at Heathcote Health.
I'd like to thank the IHF for the recognition. Our safety of our community is of paramount importance to us, and we did get the feeling early on in the pandemic that our planning and preparedness may not have been at the level that would give us the ultimate safety for our community. We partnered with Energesse, and very fortunate for our community that we did so. Through the use of the tool, we actually identified over 50 preparedness elements that we had either not given due consideration for, or we had actually not considered at all. So the implementation of the tool for us was very important, and we used the tool and the different features of it to ensure that we provided our community with the very best protection during the pandemic. And that extended to our staff. And key elements for us were around our aged care services, making sure that those particularly vulnerable groups were as protected as possible, and learning about the developments overseas that we could apply locally was really important for us. We also looked at work in the community, particularly our vulnerable groups there around immunisations and vaccinations. So the tool itself gave us a real good springboard to confirm that by using the tool we're able to give the best possible protection for the community.
Thank you, Dan, and thank you to the IHF, and we hope that this case study will be helpful to organizations around the world on their preparedness and response management moving into the future. Thank you.